Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
The Mindy way.
As she is every Tuesday, Dr. Jitka Lom from ExpressCare is here. Dr. Jitka Lom, MD. I am merely Jason Salas, DORK. So very happy to be with you. Well, happy to be along for the ride. And of course, you always educate me as well as the rest of our community on important topics. And tonight we are talking about anti-inflammatories and steroids. A lot of people are so familiar with steroids only because, you know, they're so linked to baseball scandals and, you know, football guys getting really, really big and everything. But they do serve a very distinct, deliberate medical purpose.
Sure. So the kind of steroids you're just mentioning are the anabolic steroids that like bodybuilders use and so on. We're talking here about therapeutic steroid medication that will help reduce inflammation, and that is the purpose of both anti-inflammatories like Motrin and Aleve and those type of medicines, and steroid medicines like prednisone to help reduce inflammation in the body.
Now, when we talk about inflammation or swelling and things like that, are we talking about your garden variety? I was cramping up, or like my arm just felt like a little stiff that day, or the common afflictions that end in itis, the bursitis, tendinitis, things like that, or is it more serious things? No,
it can be all of those things that you mentioned. Any itis is inflammation, or so for example arthritis, when people get swelling of their joints and so on. Inflammation just means redness, swelling, and pain. Those three things need to be present, and then there's inflammation. You can measure it actually on a blood test too, the amount of inflammation in your body.
Now this sounds to be counterproductive because, as you said, bodybuilders take steroids to get bigger. So why would someone want to take a steroids and anti-inflammatory, two completely different sides of the pool?
Right, they're completely different. The word steroid is used sort of to cover, let's say, a chemical, a molecule, okay? And there are good ones and bad ones, let's say. The kind that are used for anabolic steroids, that's one category, and the kind that we're using for medicine is a completely different category, and they have nothing in common except the title steroid.
Okay, so I know that people take steroids for lupus.
Right.
That's commonly caused. I know steroids are also sometimes treated for people post-surgery. Am I correct?
Sometimes, yeah, or if they have a lot of lung inflammation, like a bad bronchitis or a COPD patient, those kind of things, severe asthma, that's another inflammatory condition. Pretty much any condition where you're very sick is an inflammatory condition. Steroids aren't always appropriate, but many times they will settle it down. Your
cells are working a lot harder to try and repair themselves and improve the body, and as such, they kind of puff up, right?
In a way.
The generic non-doctor description.
It's true.
Okay. Yeah. Well, steroids are also, as I understand it, they're an accelerant or something like that?
Sometimes I wouldn't say accelerant. I would just say that they change the way your immune system functions. So for example, let's take a child with eczema. That child is breaking out with rashes on their body. They're red. They're not always swollen, but they're itchy. That's another inflammation sign. Or hives, for example. That's another inflammatory condition where there's redness, a little bit of swelling, and itch. So when we use steroids, we can use topical steroids, that's creams, or we can sometimes give them oral steroids like prednisone or that type, prednisolone, these type of medications to calm the immune system. So sometimes the immune system is overreacting, and we need to reduce that.
Now I know there is a side effect to steroids, and a lot of people call it the very crude moon face.
Yes. So sometimes, especially with these oral medications, steroid medicines, there are side effects. And if you are ever prescribed prednisone and you read the list of side effects, it's really impressive and scary. It's a very powerful medicine, can help people a lot. But one of the side effects, if you take too much for too long, is that, yes, the face gets very fat. There's a bump on the back. We call it a buffalo hump, also not very attractive. Yeah, the shape of the body changes, where there's a very large fat sort of tummy and skinny legs. The skin thins. There's problems with diabetes and cataracts and thinning of the bones. And here on Guam, very important, is kidney damage. So there are just so many bad side effects. So this medicine needs to be used with caution. So some people have, prescriptions of this. Let's say they bought it over the counter in Manila or something, and whenever they get sick, they pop these drugs. It's not something you want to do.
Are they addictive?
They're not so much addictive, but you develop a sort of a need, because your own body creates steroid medicine in your adrenal gland. It'll create cortisol, cortisone. This is words you might be familiar with. So your own body will create steroid medicine to help calm your own inflammation, because you don't always need drugs. You sprain your ankle, you get better because your body created its own steroid. But if you keep taking external steroid medicine, it suppresses your adrenal gland. So your adrenal gland isn't going to be producing that. Then you take that pill away, there's lots of inflammation in your body. So you go back to taking the pills again, you see? So in that way, it's not that you're addicted, but you're sort of dependent on the medicine. We call it steroid dependence.
Can people, like, again, circling back to athletes, can athletes possibly take multiple types of steroids? Because if they're taking the anabolic because they want to get bigger, they want to recover from injuries that they've sustained in sports faster, and hopefully have better performance on the court, on the field, what have you.
Yes.
And then they take those other steroids, like to combat an illness or something like that.
Right.
What are the side effects of those?
Well, typically they wouldn't want to be doing that. First of all, they shouldn't be taking the anabolic steroids anyway, because those are tested, right, prior to competition. And typically athletes would not want to be taking the strong anti-inflammatory drugs like prednisone, because they're going to mess them up. Instead, they're taking the milder non-steroidal anti-inflammatories, NSAIDs, non-steroidal, meaning things like Motrin, Aleve, Voltaren, these kind of naproxen. These are drugs that you can buy over the counter, and athletes might be taking them pretty much like candy a lot of the time to settle down their inflammation in their sprained ankle or their bruises and strains and sprains. And because these drugs are available over the counter, you can easily take them and even give them to your children. Let's say your child has some sort of, it's a gymnast and has sprains, and you might be giving a lot, and you can give too much and again cause kidney damage. All
right, well, we will return and we are going to talk about anti-inflammatories, but anybody, if you'd like to learn more about steroids from a sports perspective and why you should not do it, read up on Jose Canseco, the book Juiced. Excellent read. We'll be back after this.